Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals from the entire country to speak about topics that you wanted information about, all the health and medical related topics that you wanted to go meet a doctor but you're not finding enough time, or you wanted more resources before you want to visit a physician. Here is a chance. Please do join us on YouTube, Facebook, or Instagram. But if you have a question, we give you an opportunity of asking the expert directly on the YouTube chat only. You can watch it over all the other digital media, but if you want your query to be asked, please do hop on to the YouTube chat and ask your question there. Type your question there. I shall place the question before our expert. On this show, we also have a health quiz where you can win prizes from Apollo 24/7. And also, we give away discount vouchers and coupons towards the end. Stay with us, download Apollo 24/7 and get the entire Apollo Hospital services in just one app. तो चलिए आज का टॉपिक है हाउ टू स्टॉप स्नोरिंग. खर्राटे हिंदी में, गुरुकुलु इन तेलुगु, whichever language में क्या भी आप बोल सकते हो, पर snoring is not just a social problem, it is a health problem. Let's understand how to stop snoring. What are the treatment options? We have an expert joining us today, a pulmonologist and a sleep medicine specialist, Dr. Srikar Darisetti, who's a pulmonologist from Apollo Hospitals, Jubilee Hills, Hyderabad. With more than 11 years of experience, he can be consulted for respiratory conditions, sleep-related disorders, pulmonary surgeries, and is a member of the American Thoracic Society, British Thoracic Society, Indian Chest Society, European Respiratory Society, and Indian Society of Critical Care Medicine as well. And he is the faculty and he chaired multiple conferences and panel discussions at the state and national level conferences. He was awarded first place in the Indian chapter of the quiz conducted by American College of Chest Physicians in 2020. And here we welcome Dr. Sridhar Darisetti. Namaskaram, Andy. Welcome to the show.
Yeah, namaste, Andy. Thank you. Thanks for the invite and thanks for the opportunity.
Thank you. Thank you, Dr. Garu. So as I was introducing, all this while we have been thinking of snoring in very different ways. Either snoring is supposed to be understood earlier as good quality sleep. कोई खर्राटे मार के अच्छा सो रहा है. Or the other way, they used to think that it's a social problem or a relationship problem, but never looked as a health problem. Now, let me understand what is snoring and how is it a problem?
So, as you rightly pointed out, in the past, snoring was viewed as a sign of healthy or a really good sleep, but on the contrary, it is not. It is something which needs to be approached, and the doctor or the physician or the health professional needs to be contacted as quickly as possible, because snoring basically is the vibration which is produced as air is passing through the narrowed throat. సో అంటే ఇప్పుడు మన గొంతు ఉంటుంది కదండి. సో ద గొంతుది ఒక సర్టన్ డయామీటర్ ఉంటుంది. ఇన్ ఎనీ హ్యూమన్ బీయింగ్ ఇంత హైట్ ఉంటే ఇంత డయామీటర్. లెట్స్ సే 6 ఫుట్ పర్సన్ కి అరౌండ్ 3 సెంటీమీటర్స్ ఆర్ 4 సెంటీమీటర్స్ స్పేస్ ఉండాలి. 5 ఫుట్ పర్సన్ కి అరౌండ్ 2.5 సెంటీమీటర్స్. సో ఈ 5 ఫుట్ పర్సన్ కి లెట్స్ సే ఇట్ ఈస్ నారో టు 1 or 1.5 సెంటీమీటర్ డ్యూ టు డిఫరెంట్ రీజన్స్ విచ్ విల్ బి డిస్కసింగ్ అబౌట్. దట్ కాజెస్ స్నోరింగ్. సో స్నోరింగ్ స్టార్ట్ అవుతుందంటే దట్ మీన్స్ దేర్ ఇస్ సమ్ నారోయింగ్ ఇన్ ద ప్యాసేజ్. అంటే ఆ ఓపెనింగ్ కొంచెం చిన్నగా అయినట్టు. సో దట్స్ ది రీజన్ వై స్నోరింగ్. సో ద హోల్ కాన్సెప్ట్ ఆఫ్ స్నోరింగ్ ఈస్ రిలేటెడ్ టు పార్షియల్ బ్లాకేజ్. సో మనం ఏమన్నా ఇప్పుడు మన ఇంట్లో ఏమైనా ట్యాప్ బ్లాక్ అయినా we won't just say that it's so nice that a tap is blocked. So it means we need to actually give it some attention. So ఇది కూడా అంటేనండి. So no snoring is considered healthy. No form of snoring is considered healthy. We need to look into the matter immediately.
Wonderful. So, my dear audience, Dr. Srikar Darisetti ji can be consulted on Apollo 24/7. He is from Jubilee Hills, Hyderabad. If you have any questions and queries for today's episode, please go ahead and type it in the YouTube chat. If you want to consult him, we'll have a link that can lead to his Apollo 24/7 consultation. You can use that. And Dr. Saab can speak Telugu. You would want your query to be answered in Telugu, do mention that in your question and we can take it up in Telugu as well. But for the larger population, we shall keep the entire conversation in Hindi, English and bits and pieces of Telugu. Yeah. Dr. Srikar Garu, you were talking about the person and the throat, the size of the person and the constriction in the throat. Is it all
Exactly.
about a man, or is it also about women? Do women also snore and have a same kind of problem?
Yes, absolutely true, Ali. So it could be either a man or a woman, and even a child for that matter, and even a baby also. So any human being who is snoring, we need to look into the causes of it, Ali. So it is something like this. Not all snorers have some serious problem, nor does it mean that all snorers are having some serious health issue and need to be consulted. But there are different simple reasons for snoring, some complex reasons for snoring. So the best, the take-home point, if I have to mention, is that all snorers should be evaluated. We could be
All
having a very
snorers.
mild, yeah, all snorers need to be evaluated. Okay, we could be having a very
And who's the
simple
person?
underlying problem.
Yeah, who's the
Yeah.
person that one has to consult when there is a problem? So now that medicine has branched out so to super speciality, so is it good to
Yes.
visit a general physician or an ENT or a pulmonologist? Who requires who?
Yeah. So, yeah, as you rightly pointed out, Andy, it's like it comes under the umbrella of a physician and a pulmonologist and a sleep specialist, ENT. So, these are the four specialties who primarily deal with snoring. మన ఇంట్లో ఎట్లా ఉంటుందంటే when we talk about our family doctor, it's usually a internal medicine specialist, otherwise called as a general physician. వాళ్ళకి they'll be having an idea, and because it's so diversified, they would be referring it to a pulmonologist or a sleep specialist or a ENT physician. The ENT physician comes in when there's some surgery required for treatment of snoring, but usually it is the physician or the pulmonary or sleep medicine specialist who looks into the issue.
Right, right. So we understand that, as you said, आपने बहुत ही बड़ा एक शब्द यूज किया है कि no snoring should be left unevaluated. Okay, so
Yeah,
now
that's
I am tired, I am like
mm,
exhausted, or sometimes I have chest congestion or any other nose blockage, and we tend
yeah,
to snore, and we think that we are tired and we are snoring. Is there
yeah.
that is also some cause of concern?
Yeah. So here it's very clear that if we have caught a cold and we have a blocked nose or a sore throat, hence we are snoring. So coming back to the fact, if we are able, we are actually making out the reason for us snoring. So if we have never snored in the past and we have newly started snoring as a result of a nasal block or a throat congestion, then it is perfectly fine because we are aware of the fact that it is a temporary phenomenon. Once our throat congestion is resolved or our cold is resolved, we are going to stop snoring. If this is going to persist, then we need to look into the matter because a snorer always has a reason behind it. So it should not be that the person is, a healthy person, so he's going to snore. No, there should be some reason. It could be a very simple reason which can be corrected, as you had rightly pointed out, or it could be some other reason which needs further medical evaluation.
Right. And you were also mentioning that babies and children
Yeah,
are also
true.
susceptible to snoring, and mouth breathing
Yes.
happens a lot of times in children. So, do we
Yeah.
consult a pediatrician and tell them that this has always been there, and do I overlook it, or should I also mention it?
No, anyway. So when we talk about babies or children snoring, when we talk about babies, it is usually a nasal congestion which causes it. But because the reason being is babies do not have most of their tonsils developed. It's only in early childhood that the tonsils develop. If at all they've got enlarged tonsils, then particularly we call one particular set of tonsils called as adenoid tonsils in antaradi. So that is
Acha.
located quite in the rear end of the throat. So its
Ah,
enlargement can cause partial blockage of the ear passages. At the same time, it can contribute to snoring.
okay,
So a
okay,
child
okay.
who is snoring or is breathing with his mouth open, his or her mouth open, this gives us a very clear indication that we need to evaluate the child. It could be this adenoiditis or inflammation of the adenoid tonsils, but that also needs to be looked into.
Right. So, not all snorings are dangerous. Snoring तो मेरा
Yeah.
lifestyle है, मेरा pattern है. I'm used to living with snoring. These are the very
Hmm.
common observations that we make when we talk about snoring. And there are
True.
people who continuously have never got themselves evaluated. They never find it a
Hmm.
problem. Why is this so? Why don't we look at it as a problem?
Yeah, it's something like this, Andy. It's like one common myth which exists. For example, we let's say we have a cold or a sore throat, we say that okay, stop eating all fruits. So because the fruits are poor things, they never really contribute to the cold, or not did they ever cause the cold. So that just goes in. It's because that the acid content of the fruit may irritate the throat transiently for a short period of time, which is going to go away in some time. But AMI we tend to associate citrus fruits with cold. So we stop eating
Ha.
them. Itla even snoring. So snoring probably it is, dealt with a lifetime. The person is so tired, he's just falling back and snoring. So he has had a hard day at work. So that has passed down the generations. It could
Correct.
be, yeah, it could be that
Accepted
a
social
very
norm
small
that we made
exactly,
around.
exactly. It has become a norm of the society saying that, he's a heavy sleeper, so he snores a lot. But, we'll probably use that word heavy in the literal sense that probably he could be overweight. There could be some excess fat deposition within the areas of the throat, which are causing the airway narrowing and contributing to snoring. Okay,
Right.
and it could be some congestion of the throat tissues which are contributed to a narrowing, or some dental anomalies too, for that matter. Let's say if the person has a very small jaw, it's very small lower jaw, so or a receding lower jaw. Let's say it's called as retrognathia antarandi, wherein the jaw tends to go a little back than what it's normally supposed to be. So Atlantolki, they develop a snoring too. So
Okay.
when we have a person who's snoring, we just need to evaluate to make sure that this cause is not life-threatening or will not cause any long-lasting damage.
Wow.
If you have
So
also
snoring.
noticed, yeah,
Please go ahead, doctor.
yeah. So if you have also noticed, there are most of the snorers, I would say at least 70 to 80% of the snorers are either overweight or are obese, what we commonly call as fat. So the common reason behind a fat person or an obese person or an overweight person snoring is because of the deposition of excess fat within the areas of the throat and contributing to narrowing. So that is going to cause
Okay.
snoring throughout the night. If it becomes more
Wonderful.
severe, the person can actually stop breathing for some time.
Okay. I will come to
Okay.
that part
Yeah.
a little later. So you have
Yeah.
mentioned like lifestyle,
Mhm.
diet, and exercise,
Yes.
physical exercise. So do these
Mhm.
also have a very very important role, and they are stakeholders in our snoring then, in our sleep then?
Yeah, that's an undisputed claim, and that's absolutely true because a person who is, exercising regularly and maintaining his health, I mean, his weight in a healthy range is less likely to snore. The other thing is alcohol. So, alcohol consumption or smokers for that matter, alcohol, what happens if consumed in excess, a small social drink, maybe 30 or 60 ml once in a while, will not cause everlasting damage. But if at all the alcohol is consumed in a large amount, that can actually contribute to relaxation of these throat muscles. So a relaxed muscle tends to fall into the mouth and reduce the size of the opening. So your throat opening
Ah,
gets narrow because alcohol has contributed to the relaxation. Smoking, for that matter,
understood.
Emothrandi, it causes excess deposition of soft tissue in the same area. So that also causes narrowing.
So it's
So both
also
these,
about the tone of the muscle, the laxity of the muscle, not just with the age, fitness, etc. It's also because of the consumption of substances and lack of exercise as well.
yeah, both of them things. So age, yes, it does contribute because you are absolutely true when you say that the muscles tend to get a little weaker with age. But aging alone does not cause so much of muscle weakness to predispose a person to snoring. So we cannot say that,
Right.
oh, the person is 70-year-old, he has weak muscles, so he's going to snore. Even in a 70-year-old,
Okay.
I will definitely try to evaluate. Who knows, he may be having a small neurological issue which is contributing to the snoring.
Correct. So here's an interesting question that I observed from one of a registered user. How can I improve
Mhm.
my breathing if I'm snoring?
Yeah, so that is basically, I mean, thank you for the question, but it's slightly paradoxical because your breathing is affected because of your snoring. So you need to address your snoring issue first. What is contributing to it? Is it at the nose level? Is it at the throat level? Okay, is it because your tongue is actually falling back? and partially
Yeah.
blocking your throat? Is it because you're overweight?
Okay.
So all these reasons are contributing to the poor sleep, not just the snoring alone. So the snoring needs to be addressed first. The sleep will automatically correct itself.
And here's my next question from Arun, who's a 35-year-old male. Is snoring
Yeah.
curable? Now let's come to the options that are available. Is it curable?
Yeah, so absolutely. Thank you for that question because will be talking about the most important aspects of snoring. So once we have come to a conclusion as to what is causing the snoring, first thing is lifestyle changes, as we have just discussed. You have to stop smoking. We need to, either stop alcohol consumption or keep it at a bare minimum. And we need to incorporate a healthy diet and exercise. So once these four magic things are in place in our lifestyle, after that, we start addressing the other aspects. Then we go for a evaluation. We need to go for a evaluation of a nose and the throat. So we need to pinpoint the level at which the snore is generated. Based on that, our therapy start. So let's say I've got a partial obstruction of my throat because of large tonsils. Then I would consult the ENT physician and get them removed. Or if I've got a narrowing of the throat because of my weight, then I'll focus on weight reduction. But weight reduction is never a one-day process; it's a long process. So in the meantime, we have got devices which can send in or pump in air at a high pressure so that the narrowed airway opens up. We are using pressure to force the airway to open up. This is what we commonly know. During the COVID time, we have heard of the term CPAP device or a BiPAP device. So that is a continuous positive airway pressure. That's what CPAP stands for. So the machine is providing a continuous pressure to splint or to open up the narrowed airway. So these are the basic things, and we go by the other treatment modalities as and when we come by those respective conditions.
Yeah. So, Sarabjit Singh ji पूछते हैं, is snoring also related to the bone in the nose being tilted?
Yeah, absolutely true, Sarabjit ji. That is because of what we call as a deviated nasal septum, but a deviated nasal septum cannot alone cause that much amount of snoring because it will cause just a mild snore, or rather, it will cause more of a nasal block rather than snoring alone. So, that will contribute to only about 10 to 15% of your snoring. So, if you're snoring in spite of having a deviated nasal septum, we still need to examine the throat and the throat as a whole for looking for obstruction at some level.
Okay, okay. So here's how to stop mouth breathing. This is Amit Kumar De.
Okay. So, I mean, mouth breathing first, first step to explore this, Amitji, is to check how long it has been there. Has it been there from your childhood? Did it start at some point later? Is it there for a couple of weeks, months, or years? So, based on it, and along with the other terminologies, weight, then the shape of your face, okay, shape of your jaw bones, okay, the alignment of your teeth. So these are the things which I would check for a person who is constantly breathing through his mouth. Okay. So after
Right.
checking that, then we go by the either the medical therapies, which one thing which we have just talked about, that is continuous positive airway pressure, or we go for we go for splinting. There are some certain splints which are called as mandibular advancement device. So let's say I've got a jaw which is slightly receded. I can put in a splint to put my jaw in the right position, then I'd automatically stop mouth breathing. Okay, so
Right,
we need a
right.
complete workup for it. A habitual mouth breather needs a little more radiological evaluation. Maybe I'll have to get an X-ray of your throat done, probably an MRI
Yeah.
scan to check the exact alignment.
Right.
Yeah.
So here's another question with the child, 4.5-year-old child, opening mouth while sleeping. Jishan is the father. Kid sleeps slightly open mouth with lips and mouth open, sometimes
Yeah.
heavy to mild snoring. Should I be bothered, or is it natural and no has no health impact? Also, I do snore heavily too. Is this hereditary?
Yeah. So as far as the hereditary aspect, I'll go to one aspect of it. Hereditary aspect is a bare minimum. There are very, very, very few people, less than 1%, who may have a slight weakness of their throat muscles, which can contribute
Okay.
to snoring. So I cannot write off a person because there's less than 1% of the people who can have this issue. The remaining 95, 99% do not have this issue. So hereditary forms a very, very small, minuscule component of it. Now, as far as
So,
the child is concerned,
so the father
a
is
four,
snoring and the son is snoring. He doesn't need to worry about that factor. Those two are separate issues.
they are two separate things. So it's something like I mentioned the word hereditary cause of snoring after ruling out all the common causes of snoring. It is the last thing I'll pick up in the list rather than the first one. Okay.
Right,
The other
right.
way, like if at all I have a father who is asthmatic, I have a son who's asthmatic, I'll think of genetic component or hereditary component first, but not so in the case of snoring. It will be the other way around. I'll first rule out the other causes before going to genetic. Now, as far as the little boy or the son is concerned, he's 4.5 years. The first step is to get an ENT evaluation to check for the tonsillar size. Next, of course, how long is he be snoring? Is he feeling sleepy in the daytime? Is he active during the daytime? Does he tend to sleep off in school? Is he feeling tired and lethargic? These are the other accompaniments to assess the quality of the sleep which the child is having. So, an ENT consult for the child is a must.
Right, doctor. Thank you. So here's a registered user's question. High sound during snoring. What does this mean? Is soft snoring okay and loud snoring a disturbance? Is it just a disturbance? All snorings. This is my question. Like, are all
Okay.
snorings equally? Are the sound or the intensity or the duration of the snore? Does that have an impact on your health more?
Not directly, Andy. So it may be so that a heavily obstructed throat may generate a very low volume of snore, and someone with a mild disease can have a loud snore. So it doesn't
Oh,
go in that way. It doesn't go in that way. So it's
okay.
something like the most obese person or the fattest person may not have even diabetes or high blood pressure, and someone who's slightly overweight has a slight bulging of his belly may have severe diabetes, I mean, severe hypertension or
करेक्ट
poorly
करेक्ट
controlled diabetes.
तो
So it
आवाज
goes
के
that
साथ
far.
ये बड़ा है या नहीं है नहीं बता सकते कि प्रॉब्लम डीप है या नहीं है
Generally,
ये बताने
no,
ओके
we cannot this thing. And likewise, as we just talked about CPAP, the thinnest person with snoring may require high pressures, and the fattest person with snoring may require low pressures. So it just doesn't go by the body size and the volume of the snoring alone. Each individual is different for that matter.
okay great so Mayank Goel has an interesting question he has
Yes.
OSA obstructive sleep
Yeah.
apnea and I use BiPAP machine can my OSA be cured so that I don't need to use this machine in the future and how long.
Okay, so Mayank ji, the first thing is your OSA has it risen only because of you being a slightly heavier person or having a slightly more weight. If that is the case, simple weight reduction is enough to control OSA in more than 70% of the cases. But let's say
Okay.
if it is not just heavy weight which is contributing to it, then we need to once again look for your size of the jaw, alignment of your teeth, and the location of the soft palate. So soft palate is something which we can feel when we push our tongue back. Suppose I'm feel using my tongue to feel the roof of my mouth. The initial part is hard, so that is called as the hard palate. If I push my tongue further back, I'll be able to make out a softer feeling. So that is called as a soft palate. So sometimes we have some soft palate abnormalities wherein the soft palate collapses a little more than needed and causes obstructive sleep apnea or OSA. All this is corrected by CPAP or BiPAP. Depending on the pressure, we decide whether we give CPAP or BiPAP. All of these can be corrected. But we also need to know what is the reason behind your OSA coming. Based on that, we can tell whether it's curable or not.
Okay. So there's Armash, who's 29-year-old male. How to cure OSA? I am overweight now. I used to snore even when I'm very fit. Is so now that you were talking about CPAP and BiPAP, who requires what? How does this machine help them?
Yeah. So that is the interesting part about who requires CPAP or BiPAP. It's simply done based on a sleep study. So during a sleep study, we make out or we assess the amount of sleep disturbance. That is the number of times the person is snoring, how much of it is contributing to sleep disturbance, that is shifting from a deep sleep to a light sleep. All these are evaluated and we decide the pressures. First, we put in a
Yeah.
trial value, that is, in the middle of the night, we start with CPAP. We check whether it's sorting out or reducing the sleep disturbance. If not, we go for a BiPAP. This is the simplest way of doing it. And
Right.
once again, the cause decides the duration of the therapy. So if you've got, let's say you've got a bony abnormality, a jaw abnormality which is contributing to OSA, then CPAP or BiPAP alone will never correct it. We need a ENT evaluation and probably go for a corrective surgical therapy. So
Right.
the
These are
reason,
so intelligent and complex कि हम इनको
yes,
इतना simple सा नहीं ले सकते. This is something more,
Ji.
technical studies have to happen.
Absolutely. So we cannot say that, okay, this person is snoring. I have some knowledge. Let's put him on a CPAP. No, that doesn't go in that way. Yeah, that is true for at least maybe 80 to 85% of the people. But the remaining 15% require evaluation and we can never treat them unless we evaluate them.
All right. So Mayank ji ka question tha last time, if you remember, you were
Yeah.
suggesting that how long does he have to use CPAP was his question. He now has
Yes.
added additional information to his chat. Mayank ji, आपका additional information कहाँ miss हो गया? So he was saying this that he was, yes, he's overweight and I missed his information some reason.
So,
I'll find it and get back. But on the machine, it was around around 80-85. With the machine, it comes to 5 or 6. That's what I remember if I've seen it
oh,
correctly. So how long
yeah.
do I have to continue was the question.
Oh, okay, okay. So that in case of you, Mayankji, we have to go for a more stricter and rigid weight loss regimen. We need to incorporate diet and exercise very seriously so that, and also we have got some jaw exercises too at present. It's called as myofascial therapy, wherein they try to exercise, suggest certain exercise to reduce the amount of fat deposition over the face, whether it is under the
Hmm.
chin or if it is in the inner part of the throat. Okay, because
Okay.
overall weight reduction sometimes may not reduce this. If you have also noticed one set of people, two sets of people, one, let's say person X puts on 1 kilo, it may be on the face, the person may look very puffy. The other person may just look over, overall, maybe his belt becomes tighter by, or a looser, I mean, tighter by 1 more inch. So this set of people who tend to get more fat deposited in the face, they are the ones who suffer from obstructive sleep apnea at a much more earlier stage of their weight gain.
Okay, okay. Right. So here's a question from Pratiksha Sajan. Dr. G,
Yeah.
you said something about neurological reasons for snoring. Also, does high BP contribute to snoring?
Yeah. So, Yaji, the thing is, neurological issues, usually the most common thing we talk about is a stroke, also called as, Pakshapatam in Telugu or Lakwa in Hindi. So, a
Rancid.
stroke is the most common cause for it because if a stroke affects that part of the brain from where the nerves to the throat are going, that can
Okay.
cause abnormal snoring in a person who was never snoring prior to the stroke. So that is the
Right,
common.
right.
But we have got countless neurological conditions. But most of these neurological conditions, which involve the throat and the mouth passage, basically, any weakness of the muscles because of different neurological conditions can contribute to snoring.
Right. And how about high blood pressure? And also, I have a question here about Puneet, who's 28-year-old male.
Yeah.
Does cholesterol level and allergies have a relation to snoring? So, high BP,
Yeah.
cholesterol, and allergies.
Yeah, we'll go by one. So, high BP alone usually does not contribute to snoring. In fact, it's the other way around. A person who's snoring for a long time because of the constant sleep disturbance and the stress which it has on the body can eventually lead to high BP. So, it's the other way around. As far as allergies are concerned, yes, you're absolutely right. If at all is causing nose and throat congestion, it can contribute to snoring. But the good part about allergies is that prompt treatment, whether it's in the form of antihistamine medication or in the form of nasal sprays, which are prescribed by the concerned physician, can reduce and completely stop the snoring. And what was the third thing, please?
Allergies, cholesterol.
Yeah. So once again, cholesterol goes in the same way as BP. Just high cholesterol alone will not contribute to snoring. But see, basically, why are we talking about snoring here? It's because of the sleep disturbance it's causing. So let's say you're sleeping and your sleep disturbance is bad because of snoring. Even though bookishly you have slept for 8 hours, your brain and your body feels that you have slept only for 2 hours. So a
Okay.
stressed body will have high blood pressure, high sugars, and high cholesterol.
Okay, right. So not directly, but there are links to it which are not directly established. One may cause the other, one may increase the other. So keep a monitor on and have a
Exactly.
healthy lifestyle. Yeah. So Dr.
Exactly.
Saab, here's a question about I don't wake up feeling fresh, and sometimes I have very dry throat after wake up. Could it be because of snoring?
Yeah, yeah, exactly. Just what we were discussing about. So they do not wake up feeling fresh. So G, I assume that you're sleeping at least for 6+ hours in the night, because anything less than that, if you're sleeping for 4 hours, you can never wake up feeling fresh. So if you're
Okay.
sleeping for the required more than 6 hours, because of the sleep disturbance, your body has micro awakenings. It means that you are not consciously awakening yourself, but
Acha.
your body switches from a very deep state of sleep to a very light state of sleep when you are snoring. So the body feels unrested, even though you have not woken up for that 7 hours in the night, except for maybe a one toilet break. Your body feels that you have been awake all night and probably slept only for about 1 to 2 hours. So that can contribute to that.
राइट सो शंकर रामन जी का क्वेश्चन था कि बस में ट्रेन में या रूममेट्स के साथ जाते हैं तो स्नोरिंग बड़ा ट्रबल है yes it's not just
Yeah,
trouble for everybody else let's understand that snoring is a trouble for our own body
yeah,
you're not
absolutely,
getting enough
absolutely.
sleep it's not a problem for them let's not look at it as a social
Yeah.
problem.
Yeah, so it is both. I mean, it is a personal problem as well as a social problem, because personally, your whole body is affected. You're not getting enough sleep, okay, and you're just under the illusion that you're sleeping properly, which is so not the case. And
Correct.
yes, the noise itself can contribute to poor quality sleep for the the bystanders or the other people in the yeah.
Right. Now with the heart issues. So they Deepak Singh ji पूछते हैं 57-year-old male is snoring related to
Yeah.
any heart disease?
Yes, Deepak ji, absolutely right. Snoring, just like how it's contributing to high blood pressure, poor sugars, it can also contribute to heart disease because of sleep disturbance, high blood pressure, and all that which can happen.
Yeah, yeah, yeah. So we understand that heart disease cannot cause snoring, but snoring can put pressure. Is that the way that we need to look?
No, no, no. As far as heart disease is concerned, poorly controlled or heart failure can also cause snoring independently,
Ah,
and other way
okay,
around.
okay, okay.
Snoring also can cause heart disease in the long run,
Okay,
and
but
then
here Raghav, who's 36-year-old male,
uh-huh.
he's asking, I'm snoring heavily in the recent days. Will my snoring lead to a heart problem? Also, I do have high cholesterol.
See, Raghuji, the thing is, yeah, you need to evaluate your snoring. If untreated, it can lead in the long run. Maybe not at the age of 36. It could be, 5 years from now, 10 years from now. We really don't know because each person is different. Okay. So it,
Hmm.
depending on the extent, let's say you're having the value of sleep disturbance, normal value, which we call as AHI, should be less than 5. Okay. Here, with this type of sleep disturbance, this snoring, for example, it could be as high as 40, 50, 100 also sometimes in an hour. So imagine you being woken up 100 times in 1 hour. What will be your sleep quality and
Oh,
how much stress will be there in the body? So, yeah. So it
see,
needs to be
most of the
evaluated.
times, yes, we do not even understand the intensity till the time that numbers are placed before us. We
Yes, yes,
have to believe
absolutely.
the tests, the
Absolutely.
technology. You think आपका घड़ी ने बता दिया, but no, you
Yeah.
aren't sleeping well, is what your monitor has said. Dr. Srikit, I
Yeah.
have family members at home
Mhm.
who have never,
Okay.
who snore and who never want to get themselves checked, thinking that जो आपने बताया है कि ये जो test है, that is going to take a long time. I need to go to a doctor and sleep, and that's going to be a very very difficult thing. So, what is a sleep test? Who requires it, and how is it done?
Okay, thank you, Jansi ji. So that's a very, very relevant question. So the sleep test, what we also call as polysomnography. Somno stands for sleep. Okay,
Okay.
polysomnography is the test. Now we have got different categories or types of that. The test which you have told about, which many people are hesitant to visit the doctor, stay overnight in the hospital, is called as a level 1 polysomnography. But very interestingly, we have got level 2 and level 3, which means level 2 is the exactly same setup which you get in the hospital can be replicated in the house in your own bedroom. So you call up the sleep technologist, he'll come to your house, you give him a time, let's say 9 p.m., he'll come to your house, he'll set up the device, and he'll go away. He'll come back the next day morning whenever you call him. You say you come at 8 and pick it up, he'll come at 8. Then he'll give you the report by afternoon. So you'll have the complete equipment attached to you, and you'll be having the luxury of your home. You won't have to go to the hospital and all that. There's another called as level 3. But of course, there are limitations. For most of the sleep diseases, even a level 3 is similar to a smartwatch which we use. Just a handheld smartwatch and a small band over the chest and abdomen. We can get a sleep study done. This also can be done in the house. So we don't have to run to the hospital for a sleep study.
Okay, I understand that sleep studies can be done at home right now, but somebody
Yeah.
who needs to evaluate this, how frequently they need to evaluate their sleep study? Is it just one time study?
Yeah. So first we do the sleep study to get the diagnosis. What is causing the sleep disturbance? After getting the diagnosis, after we decide what therapy we are supposed to give, then we start monitoring. Let's say, as you have pointed out earlier, Jansi Garu, that a CPAP device. So the CPAP device has an SD card, just like our phone memory card in it. It is going
Correct.
to, you can get a periodic data from the SD card saying that how much you have been snoring, whether your AHI, which I talked about, should be less than 5. Is it really gone to less than 5 because of your machine usage, or it is still on the higher side? This data will then tell us when we are supposed to subsequently call our patient, or are we supposed
Oh,
to repeat a sleep study. So if our
okay.
AHA values have gone low, he has lost weight, we'll repeat a sleep study and probably we can even stop the machine. So it goes in that
Wonderful.
fashion.
Great. So Mayank ji has come back with another set of questions related to his CPAP machine. So he is
Yeah.
using a BiPAP CPAP at home. Sleeping using BiPAP or the CPAP at home is fine, but while traveling or I trek, I cannot use the machine without power and it makes me paranoid to sleep. How can this be addressed? Any device that you can suggest?
See, we have got these battery backup CPAP devices difficult because that consumes a lot more power. So when you are traveling on the night of the travel, it would be a little difficult. Of course, if you're going in a flight or in a train, it is still possible. Okay, but yes, when you're on the move in a bus, for example, it is impossible to use it. So when you land in your hotel and all, it's better you reconnect the power and use. So because it's a small portable device, it's better you carry it along and not miss the CPAP therapy on the days of your travel.
Yeah, yeah. Wonderful. So I do
Yeah.
have a friend who carries CPAP to wherever, whichever country that they go. They plan their journey according to the not the time of the day. They make it
Hmm.
convenient. For him, he's understood that the machine is very important for quality sleep, and he
Yeah.
plans his travel around the sleep time. So that's one way
Yeah,
to
yeah,
manage.
absolutely. Jansi Garu, because the thing is, this we need to understand is a mechanical therapy. So you connect the machine generates that positive pressure air. So it's going to work only for the time duration of for which the machine is put. If I put the machine to the
Correct.
side, it's not going to help me. So I use it for 2 hours and then sleep for 4 more hours without it. I'll still wake up feeling unrefreshed because I use the machine for 2 hours, which is insufficient.
Correct.
Sorry.
Right. So yes, I think your question is answered there, Mr. Mayank. And Mr. Burman, 50-year-old, asking, what sort of medical interventions help other than the machines?
Okay. Medical interventions will come into place in a very select few of patients, sect of patients who have been diagnosed and have some underlying disease, let's say a cardiovascular disease. So these set of patients just need to step up their cardiac medication if the snoring is being contributed by excess water or in the throat. Because as you're well aware, a person with heart failure has a lot of fluid in his body. His legs are swollen and all. So if his throat gets swollen, you adjust the medication. Then, in addition to the CPAP machine, it will come down only with medical conditions. Or if we have got a surgically correctable thing, as I told you, malpositioned jaw, malpositioned teeth, okay, tonsil enlargement. So all these can be corrected by their respective surgeries. Then we don't need a machine.
Right.
Except for these set of individuals, the rest of them do require a CPAP machine for correction.
Yeah, Joe, what about these home remedies or those small clips that you get and the over the counter, there's so many advertisements which can lure you into buying things. Do they really
Yeah.
help?
So if you talk about nose clips alone, I won't really go for that because blocking the nose would simply prompt the person to open his mouth and continue to snore. We have certain implants wherein the nose, it has got something like a one-way valve. It's placed into the nose. It generates pressure by itself. Okay,
Okay.
so that positive pressure it generates helps in opening up the airway. And we have got orthopedic pillows too. So that, of course, orthopedic pillows, once again, it's called orthopedic for a reason because the orthopedician assesses your neck length and the amount of fat and everything, then decides what height of a pillow to use. Okay, that will
Okay.
again contribute to some amount of airway opening. And we also got, as we discussed, mandibular splints. So placed inside the mouth helps to advance the jaw to some extent so that the narrowed airway tends to open up a bit because the jaw is moved forward. Okay, these
Right.
devices, but should be given only with
But this
prior
is
medical.
again not an over the counter. You just go buy something and use it on your own. This is to be evaluated by a physician or a
Absolutely.
pulmonologist.
Absolutely, Andy. It has to be evaluated. We should fit into that particular category. Even we have got
Hmm.
nowadays, we have got certain stimulator devices. Let's say they've got a neurological weakness. We have got a nerve stimulator device which can actually, relax the throat or to contract it at the right time. So the person will stop. But we should fit in the category. We should assess the
Right.
patient and only then can we prescribe.
Correct. So Kala was asking, where's your question? Yes, Kala Manyam, 46 male. Normally, I snore during winters and rainy seasons, and I feel tired throughout the day and frequent yawning. 6 feet tall, 92 kilos. Does the season have any effect?
Yeah, if you've got seasonal allergies, that can contribute to some amount of throat and nose congestion. Okay, so that can
Okay.
definitely contribute. So it may not be
Right.
apparent, you may not be sneezing a lot. So it's better we get that addressed. Probably a decongestant medication or an antihistamine medication could help decongest, and then we can check whether you're still snoring after usage of the medication.
Right. So we did talk about how important lifestyle is management of exercise diet. Does diet play any role? What kind of diet do you advise?
No, Jansi Garu. It's like diet alone, no. So whatever diet changes we are supposed to make, it's only to incorporate weight loss or to keep weight loss as a target. So it doesn't mean that we have a fatty meal, we are going to start snoring the next night. It's only weight gain which
Right.
is going to contribute. But the only exception here is smoking and alcohol, as we had discussed earlier. So heavy bout of alcohol, even a thin individual can snore a lot and have poor sleep quality. That's the only thing
And
about diet.
Pratiksha has come back asking another question. Does yoga
Yeah.
and pranayama, breathing exercises, help in snoring, control snoring?
Yeah. So, this is a very important thing because we do, address yoga in our highest sincerity because, yes, it is a very good form of exercise and it does help in curing, not exactly curing, I'd say controlling. So, the why I'm using the word controlling because yoga alone will not help a person. Let's say a person is a hypertensive, he's practicing his yoga diligently. Along with the medication, good yoga practices will help him. Same way for sleep. So, yoga maybe may calm his mind and help him to sleep off quickly. But if he has got a physical or a structural abnormality, what we are talking about was structural issues, narrowing of the throat and all, that alone cannot be treated by yoga. So we really
Right.
need to go for weight loss or whatever therapies it is and practice yoga to add as a standby or a adjunct, benefit along with the conventional therapies. Yeah.
Absolutely, but make it a point that you're exercising well, have yoga, pranayama in your
Exactly.
daily routine, and
Yeah.
continue whatever that you have to do with the medication or support systems.
Yeah, with the
Next,
intervention. So do not stop
yeah,
your yoga, but yeah, you can continue it along with your other therapies.
great. Abhishek, who's a 38-year-old male, Abhishek is unable to properly sleep in the night. Uh, once in 2 weeks due to snoring. Okay, Abhishek का question मुझे ठीक से समझ में नहीं आया. But
Yeah.
Abhishek thinks that he is not sleeping well due to snoring. Is that the way, or is it the other way around?
Yeah, it is actually one way because sometimes what happens is the person is in such a light sleep state that his mere snoring can end up waking him. So that usually happens in the initial part of the night. So many a times they say I feel the choking sensation or I hear myself snoring and then I wake up. That's perfectly possible, but that contributes to only about 1 to 2%. The remaining part is, as you mentioned, Jansi, that poor sleep quality because of snoring rather than this way around.
Right.
Okay, so we need to address the
So,
issue, especially
yes.
affecting
Next
sleep quality.
question is long-term use of CPAP or BiPAP safe?
Yeah. So most of the time, CPAP or BiPAP usage is taught by either the physician or the treating physician or the technologist. It's absolutely safe, but once again, it is a mechanical therapy. It's only helping you lose weight or get some corrective procedures done in order for you to be off the CPAP or BiPAP. So it is only like a
Okay.
splint. It's something like a walking stick for you. So you won't get
Right.
addicted to it. You once your
Ah,
sleep quality improves, when we assess you again, we'll stop the CPAP or the BiPAP.
okay. So here are some common myths placed in the form of questions. Using camphor or eucalyptus oil by the bedside in the night improves breathing and lowers snoring. Is that true?
Yeah. So that works out. Camphor eucalyptus will work only if you've got a congested nose or a throat, a very bad
Ah,
sinusitis or a very bad cold or a sore throat, and you're snoring because of that. Decongestion will definitely help, yes. But not if the person is overweight and is snoring. Then camphor has absolutely or eucalyptus has absolutely no role in that situation. Only for a select set of
great.
people.
A simple logical answer there. Thank you, doctor. Shrikant K, 51-year-old male, how to stop snoring by ourselves at home? Can I do it only by breathing exercises?
Once again, no, not by breathing exercises alone. So if we are already, we have diagnosed what's causing your snoring, then yeah, you can continue breathing exercises. Once again, an add-on therapy. If you are taking some time to visit the physician or that, you can try to learn to sleep on your sides, either the left side or the right side, or you can tend to sleep on your chest and belly. Okay, బోర్లో
Okay.
పడుకోవడం అని అంటారు కదా.
Ah,
So that
ah.
can reduce snoring to some extent. I said only reduce, but it's definitely not the treatment of choice. Okay, we need
Oh.
our other methods because these are only like I like transient or temporary measures.
All right. So I was thinking that you will say no, there are no options. But glad that you did say that there are temporary options, but there are long term management is mandatory. Great, doctor. Thank you.
Absolutely.
So, Venu Suram is asking, Dr. Garu, you had mentioned about myofascial therapy and exercises. Can you point out the exercises which are involved, or do we need a therapist? Do I need to take a consult for that?
Yeah, we can actually consult a physiotherapist, usually a neurophysiotherapist. The physiotherapist who's subspecialized in neurological care, they are the ones who usually tell us how to do these exercises. They're a little complex. It's not just, opening or clenching the jaw, which we commonly think. They're a little complex exercises. They need to be taught and you need to be supervised initially until you get perfect in it. So usually a neurophysiotherapist does this particular training. So,
Great. All right. So again, I was waiting for somebody to ask about sleep apnea. Not many have asked OSA general questions, but somebody who's already gone through. Can you please
please.
brief us about what actually happens when there is sleep apnea and the break, the silent moment, and then sudden start of the breathe? Can you please explain what it is and what is that a red flag?
Okay, so I'll explain in about 2 minutes. First, we need to just know a little about the phases of sleep. So, when we fall asleep, we go into what we call as a deep sleep, and later we have sleep which is interspersed with dreams. Okay, so
Okay.
when we fall asleep, we go into a deep sleep. So, just imagine two situations. Let's say a person has fallen asleep at around 11 p.m. If we wake him up
Okay.
at 11:45, he's going to be so drowsy, he'll be so sleepy. If I do not wake him up again, it's most likely he's going to go back to sleep. This is
Correct.
because you've woken him up in the deep phase of sleep. Now, let's say if he has fallen asleep at 11 p.m. and you're waking up at 3:30 a.m., he's going to wake up. Most probably, he'll be in a part of a dream. He might be running or jumping something, and he'll think that, "Oh, what's happening? Why am I not jumping in real life?" So he'll be in a dream phase, but he's definitely going to wake up a lot more fresher than a person who has woken up 45 minutes after falling asleep. So this is the
Correct.
dream phase of sleep. So now the simple thing, when a person has obstructive sleep apnea, okay, it could be because of the other reasons. The narrowing of the passage could be because the tongue has gone too much into the back and it has started blocking up the airway, or it's because of relaxation of the soft part of the throat, which is called a soft palate. Whatever be the reason, whether it's because of being overweight, overconsumption of alcohol, associated cardiac disease, all these things have contributed to this obstructive sleep apnea. So there is obstruction which is causing sleep apnea, that is poor quality sleep. That is nothing but obstructive sleep apnea. So what
Hmm.
happens? Why I've spoken about this deep phase and the dreams phase. So
The
during
dreams.
phase, yeah. So deep phase, yes, the body does get relaxed a bit. The person can snore, but during dreams, just imagine. I mean, a person can jump. He can, fly from a bit from the top of a building, anything for that matter. So to prevent that from happening in real life, the body tends or the brain tends to paralyze the whole body. Okay, your hands and your feet won't be moving except your heart, lungs, and stomach and all the vital organs. Your muscles are all paralyzed. So that's because you don't hurt yourself. You may be jumping off a building. If you do it in real life, we'll injure ourselves if you try to jump off a bed. So that's our protective mechanisms, which every human being and every animal has. But this also means the tongue and the throat is paralyzed too. So the paralyzed tongue tends to fall back a little more firmly on the airway passage and tends to cause more blockage. So a person who's having obstructive sleep apnea is going to snore a lot more during the later part of the night, that is the dreams phase, rather than the initial deep phase. So
Okay.
this is what treatment is all about. It simply means that when you're prescribed a CPAP, you have to apply it throughout the night. If you're applying it only for the first 2 hours, that is the deep sleep phase, you're missing out on the more sleep disturbance phase in the later part of the night when you're actually dreaming. So
Okay.
this is the reason
Okay.
behind it.
Amazing, doctor. So much happens with our body while we are sleeping, and
Yeah.
we don't care enough. I think we should put a little more focus on how we are breathing. Two last questions, and very less time that I have. One is
Yeah.
that I snore sometimes heavily, and sometimes I don't even snore. I'm just breathing heavily. Is this snoring, and can I get rid of it?
Yeah, so you require, of course, apart from the usual thing which I'm telling all throughout that you require evaluation, heavy snoring and light snoring can be related to the posture. So if at all you
Acha.
are lying on one side, you could be snoring lesser. Because when you're fast asleep, you'll never realize that you're snoring unless your bed partner or a kid or your wife, whoever it is telling you. So they say that, this part of the night you're snoring less and all, it usually is related to the posture. So if you have
Okay.
turned to your left or your right, you'll snore much lesser. And you go back onto your back, you lie flat back like this, you're going to snore more. So that could be
Okay.
related. But yes, it does require evaluation.
All right. So Ravikant's question was the same question. Whenever I sleep facing roof or the ceiling, I snore and it breaks my sleep immediately. Is that a problem?
Yes, it is because it means that your snoring is loud enough to wake you up from the initial light phase of sleep which you have prior to going into the deeper phase of sleep. Because that's how we all fall asleep, right? We first slowly doze off and then go into deep sleep. But in the initial part, we can actually make out. We may sometimes feel a little jerky, or if someone opens the door, we'll wake up. So during this time,
Very
if you're actually
light.
snoring, lying back, you may end up waking up.
So okay. So, but still, Ravikanji, it's better that you go back. I know you joined towards the end. Go back to the
Yeah.
after the live. You please go back to the recording. Doctor has given us wonderful ways to assess yourself and get evaluation ka importance. All of that. Don't miss the entire session once again. Dr. Shrikar Darishattigaru, I think come to the end of the session. I can't take any more questions from the audience. But today it was a wonderful, I must say, this is an enlightening session for myself as well. So thank you so
Thank
much for
you.
being with us. And now I want some top tips to understand how to stop snoring and how to have good quality of sleep.
Okay. Yeah. So the first tip is to assess every snoring or take every episode of snoring seriously unless and until we are very sure of the common things like you've caught a cold and you're snoring, or your sinuses are bad, or your throat is bad. So this is the most important thing. The second thing is, after your snoring has been evaluated, it is better first to consult either a sleep specialist or a pulmonologist or a physician. Then, if at all these specialists recommend, you can visit the ENT physician for looking for any correctable or a surgically correctable cause of snoring. When your therapy is prescribed, usually it is called as a continuous positive airway pressure device. During this time, it is mandatory that you use it throughout the night and not just for 1 or 2 hours in the night, thinking that you have used it. After that, get periodically assessed so that the concerned physician or the surgeon assesses you and feels or tells you whether your snoring issues have come down further, how frequently you need to monitor yourself, and also take care to maintain a healthy weight range, okay, and abstain from alcohol or smoking if you have a snoring issue. And then after that, periodic assessment may actually make you free of snoring, and you can quit therapy altogether if your underlying condition has been assessed. It's not a lifelong curse. It is something which we can address and cure or treat in an appropriate fashion.
Wonderful. Thank you so much. And I wish people understand the importance of having good quality sleep, and not snoring is not just a cosmetic or a relationship or a social problem. It's deeper than that.
Absolutely.
Thank you once again for being with us on this Sunday morning, Doctor.
Yeah. Thank you,
Thank you.
Jansi Garu. Thanks a lot to the audience for your questions and your interest in the sessions. And thank you once again.
Thank you. Thank you. So, चलिए अभी आपका time है. Now I'm going to ask you questions. You please answer the questions on YouTube chat. Health quiz coming up. 3 questions I'm going to ask. And if you want to participate, please do type in the YouTube chat box only. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if you are a winner, please do write back to us with all your contact details at marketing at apollo247.com. I'll be taking your names towards the end. Gift vouchers will be shared with you. आज के 3 questions स्क्रीन पर डाल चुके हैं, and here are the questions. Fill in the blanks. Noisy breathing caused by an improper inflow and outflow of air during sleep is, fill in the blanks. The word starts with S and space OR space N space. So I repeat the question number 1. Noisy breathing caused by an improper inflow and outflow of air during sleeping is dash. So question number 2, yes or no? Snoring can interfere with your sleep cycle. Yes or no? Can snoring interfere with your sleep cycle? Question number 3, true or false में answer कीजिए. Women rarely snore. Is that true or false? Women rarely snore. Is that true or false? These are the 3 questions for today on Health Quiz. And now it's the time for you to answer the questions on YouTube chat. While you keep doing that, I'm going to give away the gift vouchers that you can use in Apollo 24/7. Well, nice. I can see a lot of people are answering. Please send your answers on YouTube chat. Here are the coupons that you can use on Apollo 24/7. The first one is code AskDoc150. ASKDOC 150. You get to consult top doctors direct from Apollo Hospitals, and you get a 150 rupees cash back on online doctor consultation. Terms and conditions, of course, apply, and you have to download Apollo 24/7 to use this voucher. And the next one that you can get to use is first 3. You order medicines direct from Apollo, get 25% off on online medicine orders. And of course, you know that when you order medicines from Apollo 24/7, you get a 2-hour delivery as well. So go ahead, download Apollo 24/7 and use these 2. And exclusively for our Health Hour viewers, there's this code HH247. You get 199 off on online doctor consultations and up to 20% off on medicine orders. This can be used in addition to the other coupons that I have given away. This is exclusively for the Health Hour viewers. And also, Apollo 24/7 can be accessed on WhatsApp. You can text or call. It's easier for us to just have a number. You can just easily avail all the healthcare services on WhatsApp as well, entire app services. 09355247247. Save that number and just text your medicines or other healthcare services as well. Chaliye, so let's see who the winners are. I'm still waiting for the winners for today. बट नेक्स्ट वीक एक्सक्लूसिव हिंदी एपिसोड करने वाले हैं हम हाई ब्लड प्रेशर के साथ. अगर कोई है तो उनको ये समझ आना चाहिए कि ब्लड प्रेशर कंट्रोल इंपॉर्टेंट क्यों है. सो लेट्स अंडरस्टैंड हाउ टू कंट्रोल हाई ब्लड प्रेशर. 22 अक्टूबर 11 AM नेक्स्ट संडे है ये. 11 AM ज्वाइन हो जाइए. लेट्स टॉक एवरीथिंग अबाउट हाई बीपी. हिंदी में होगा आपके लिए ये एपिसोड. And the winners, get ready. I'm announcing Mayank Goel, Pratiksha Sajan, Venu Suram. Mayank Goel, Pratiksha Sajan, and Venu Suram. Congratulations. Do write back to us with all your contact details to marketing@apollo247.com. Gift vouchers will be shared with you. Thank you, one and all. It was wonderful seeing your questions. And your participation is answer for a lot of those people who don't know how to ask questions or who shy away from questions. So keep asking your questions. Next Sunday मिलते हैं. Till then, namaskar. Take care of yourself.